Hello! Happy Friday! As I promised, I would go over the advanced directive for healthcare. This is the Vermont one, so this really is, they are state specific, so this is for Vermonters. You can look up your own state if you're not here, but I am a nurse at a local primary care office. I'm a care manager, so I do kind of work on these quite often to help people set their wishes in place. Cole singing in the other room. So I want to try to go through this kind of brief because it's really complex, can be, but I want people to have their wishes in place before they get sick. So anyone over 18 should complete this so that you can designate your agent. Anyone under 18 is the parents. The legal guardian would have say over healthcare wishes. So this is the short form. You can get this online at Vermont Ethics Network and Google Vermont Advanced Directive. But you can't complete it online. You have to print it and complete it hard copy. So I'm just going to try to go through this. The first time I recorded this, it was 10 minutes, so I'm trying to go a little bit faster. So this is part one, and it's the front page is just the cover page, kind of explaining it and where you can send it to the registry so that anybody can pull and access it in the state of Vermont. So page one is where you complete your information, your demographics, your name, date of birth, and you pick your agent. So you would appoint this agent. You have to actually get their permission because they have to agree to know your wishes and kind of be your voice when you don't have one. You can also have a co-agent and an alternate agent. So it could be multiple people. It could be your parents, or you could pick your husband, your significant other, and say you had a sister or somebody also could be your alternate. Primary care physician is on here, and you also have a spot that says who you do not want consulted. So that's all the first part. Then part two is your healthcare goals and spiritual wishes. This goes through what your overall health care goals include, which is really drives this whole paperwork, okay? So number one would be you want everything. You want to sustain your life at all measures. So that would be I want to have my life sustained as long as possible by all medical means. And then the other side of that would be I only want treatment directed toward mind comfort. Most people who choose that are a DNR, which is on the other next page. It just says do not do CPR. This one would be full code, right? Where it says I want everything possible to sustain your life, which would then go through the next page all like, yes, I want this, I want that, I want that. But if you're in the middle, like most people are, like I am myself, I want treatment to sustain my life only if I will. So then there's categories. Will I be able to communicate with my friends and family? Will I be able to care for myself? Will I live without incapacitating pain? Or would I be conscious and aware of my surroundings? So you would pick what is important to you. And then as you're being treated, your health care, as it either progresses to back to a healthy individual that you were to begin with before an illness or an accident occurred. Or you would pick the certain things that are the most important to you. Then you go through and complete additional goals, wishes, or beliefs. People to notify if you have a life-threatening illness. Usually your agent notifies these people. The hospital is working to keep you alive, so they're not really going through and calling everyone on this list. The agent usually takes that role and calls on your behalf and updates the family or loved ones. If you are dying, it is important for me to check to die at home, in the hospital, other, or no preference at all. Sometimes it's medically not possible to get you home because if you were, on a ventilator, and they discontinue it, you would die within minutes most of the time. But if you were at a hospice, you know, a terminal illness, and you had a longer length of life estimated, then yeah, you could go somewhere else and receive your end-of-life care. Okay, so then next is part 3, which is the part where it says if you want CPR or not. Again, goes back to that about your wishes. So if you do want CPR, great, check that. If you do not, you have to check that. So obviously I do not want or I do want. There's no in between. If you don't have this, the response is always CPR. EMS or anybody, that they have to try to work to try to save you. For me personally, in light of the virus going around right now, I don't know, to be honest. If I got ill and the rest of my body couldn't handle it, and they thought I would had some, organ damage, brain damage because of lack of oxygen or hypoxia, I don't want to live that way. So I would allow my body to take its course, and I would not have CPR. But in the event that none of this was happening and I'm going along my life as a 36-year-old, I would, and if I had, say, a car accident, what are you guys doing? Please go out of here. Thank you. I probably would want CPR because that's kind of a blunt, quick thing, and it wasn't my body taking its natural course. But right now, today, March 27th, 2020, I would say I do not want CPR to restart my heart. Yeah. And then you move on from there if I'm unable to breathe on my own. So if you went in and had some respiratory distress, usually you would be put on oxygen, and you would see how your body can maintain your oxygen level. If you are unable to, you can be on a ventilator, and that's the next choice here. If I'm unable to breathe on my own, do you want a breathing machine without any time limit? Do you not want one at all? Or do you want one for a short time to see if you will survive or get better? I would be in the middle for this. If I went in and was struggling respiratory-wise, I would want to try to have a breathing machine, a ventilator, to see if the rest of my body could heal and recover from this and fight it off. And again, the medical team that you have would determine if you're improving or not. You wouldn't be on this machine just forever, because you'd either deteriorate or improve. And then they kind of do a health status check-in to see what to do next. I don't know the length of time, though. I mean, I guess it depends on your provider and your hospital and your family and all different kind of factors. Number 3 is if I am unable to swallow enough food or water to stay alive, would you want a breathing tube? It's, again, yes, no, or in between to see if you'd get better. Number 4 is if I'm terminally ill or so ill that I'm unlikely to get better, do you want antibiotics or do you not want antibiotics? Sometimes the antibiotics are more for your comfort, so it wouldn't necessarily prolong your life. I mean, you're terminally ill, so you kind of just want to go comfortably. So that is what they're kind of talking about at that point. It's not an antibiotic that's going to cure you. It says you're terminally ill. So it's, if you had a pneumonia, would you want to keep coughing and so those kind of things you have to think about. If you did state that you do not want CPR, you should complete a DNR cold form, and that's a different form which I can also get you if you need it. And then part 4 is if you wish to be an organ donator, and your burial plans, cremation, wake, that kind of stuff, and if you have a plot or anything. the last page, section 5, is where you sign it, and you get 2 witnesses to sign it as well, which it cannot be your agent, your spouse, your parent, your siblings, children, or grandchildren, which is kind of challenging right now because not a lot of us are seeing many people. But I think that you should just sign this, have it on hand. If someone in your home can sign it and is that list, have them sign it anyway, because you kind of just want to do this now. And then in the future, when you get through this and you're healthy, we can do this at your primary care office, or you can go to your neighbors and they can sign it as a witness. And again, after that, you can make a copy. You need to give one to all of your agents. Keep one for yourself where it's handy, and send one to your primary care office and your local hospital. But you can always just send it to the registry, and then they should be able to access it. And if your agent has it, and if you were hospitalized, then they would just bring it along with them. So that's it, in a quick, kind of condensed little video for you. It's not an easy topic to talk about, but it's something super important. So even if you don't want to complete all of it, pick out your agent and tell them. Just have the conversation. Just make sure that they do know what your wishes are. Because if you had CPR, had a ventilator, and then your body heals, but your brain doesn't, that would be your new life. And I don't want to be like that. I know. So I'm not someone who wants full heroic, all medical measures, because quality of life is important to me, and I hope for you as well. So if you have any questions, give me a message or give me a call. I can't meet with you in person right now, but I can in a couple months. Okay, thank you. Be well.